My name is Paul Wesson. I'm an epidemiologist by training, and I am a new assistant professor in the Department of Epidemiology and Biostatistics here at UCSF. What excites me the most about being a researcher and a member of the faculty here at UCSF is being in a position to ask really interesting questions that relate to addressing health disparities among vulnerable populations and their equitable access to care, as well as the opportunity to work with fellow researchers to design really interesting studies to try to answer those questions as best as we can. My research is primarily focused on ways to estimate the size of hidden and hard-to-reach populations that are also often socially marginalized. While the focus of my research to date has been on populations that are at elevated risk for HIV acquisition, I am also looking to expand the scope of my research to include other socially marginalized populations, such as people who are experiencing homelessness here in San Francisco, as well as people who have experienced human trafficking. So there are a number of so-called hidden populations or hard-to-reach populations. In the world of HIV and AIDS research, these populations are often men who have sex with men, female sex workers, people who inject drugs, and transgender women. There are a number of methods to try to, number one, sample these populations because they are often hard to reach through traditional sampling, through traditional public health sampling means. But also there are numerous ways to try to estimate how large those populations actually are based off of those samples that may be biased in a number of different ways. And so that is really the focus of my research, is to examine what are the different biases that come into play with how we find and sample and recruit members of these populations into our studies. And if we knew those biases, or if we knew the nature of those biases, can we leverage that in some way to get a better estimate for how large that total population actually is based off of this limited sample that we have. I'm really excited to be a part of this new cohort of Wesson scholars. I believe that it will provide me with support to continue my research and to expand the scope of my research. It will connect me to other researchers, both among the Wesson scholars and elsewhere within the university, to inform how I think about my questions, how I'm interpreting my data and designing the studies, as well as connecting me to other professional development activities and opportunities in order to not only nurture my career as a researcher, but also as a member of the faculty here at UCSF. Having the Wesson Scholarship provides me with protected time and support to focus on my research and to really develop my research agenda. If I did not have the Wesson Scholarship, then that time that I now have to devote to my research agenda would be divided amongst other projects that have a different focus. Well, I would say that largely why UCSF is because of the experience that I've had to date here at UCSF as a postdoc within the Center for AIDS Prevention Studies, and just how positive of an experience that was in terms of the encouragement to really invest in my ideas and to really take them to the next logical conclusion, to really explore the landscape of research on my particular area of population size estimation, as well as other areas that I was interested in as well, in terms of investigating the social determinants of infectious diseases and just the overall collegial environment of UCSF that I've experienced. So that's why I'm very excited to stay on here and to add to that environment of collegiality, inclusivity, and equity.